Did you know that people sometimes see signs and symptoms that could actually save their life, but they don't really know what they mean? In many occasions, we might see a symptom or sign on our system that is indicating that we need medical help, medical attention, and we need it fast. If we delay this medical attention, this could mean that it could be dangerous or even cause our death. And sometimes, watching a video like this with 10 signs that are going to show you exactly what you need to do and when you need medical attention could change everything and the way you see the signs and symptoms that you might be showing today. Our human body has a very curious way of acting. It can show us certain signs that might not mean much. They might mean something, but not something serious. In other occasions, we might see a symptom like a headache, maybe a chest pain, something that is considered inoffensive, but in reality is something very, very serious. We need medical attention. We need to go to the emergency room, and we need it fast. And sometimes watching something like this with 10 signs that are crucial for you to recognize could actually save your life. But before I continue, please make sure to subscribe to this channel. Press that subscribe button because maybe something that I do say in this video or later on down the road could change everything and the way you see your health today, because you are changing the course of your future and actually making sure that you can stay healthy. Number 1, chest pain that lasts more than a few minutes. Chest pain is not always a matter of having a heart attack or having a heart problem. In many occasions, it could be due to a respiratory condition, to a blood clot, to maybe a thrombi that is circulating in your blood that has not yet even terminated a situation that you have, but is actually just signaling that you need a medical emergency room to fix it before it's too late. So the next time you see chest pain, don't think about as just maybe a condition of a gastritis or a heart attack, which is sometimes serious. But if you see it accompanied by shortness of breath, nausea, dizziness, or cold sweat, you need an emergency room. Number 2, a sudden and very intense headache. Headaches are very common, yes they are, but when they come out of nowhere from 1 second to the next, you're seeing something is very pungent, very strong on your head, and you're feeling that pain, this could mean that it is something serious. It could be a migraine, but it also might be signaling a brain hemorrhage, a very high blood pressure also, or something like meningitis, which is a bacteria, which is an infection caused by a bacteria in your brain, and you need to seek crucial medical help as soon as possible. Even if you see other symptoms going along with this, like for example, a neck stiffness, fever, blurred vision, or confusion, this makes it even worse. If you need something natural that can help you with brain health, look for Neuroflex, Berbrain, Metathyroid, or OnCardio from Fineland at finelandvitamins.com. Number 3, difficulty breathing without a clear cause. The unexplained shortness of breath, the feeling of not being able to fill your lungs very rapidly, or a very rapid breathing can also be caused by conditions that are less common, like asthma, maybe a severe anxiety, a respiratory infection, but you have to be very careful because some of these occasions, it could mean that you have pneumonia, that you have a heart condition, that you're having a heart attack, or maybe even something that can cause your death if you're not careful. So if you're seeing these conditions where you have that difficulty breathing without a clear cause, you don't know where it's coming from because you're not asthmatic, you don't have bronchitis or any other condition, and you've never experienced something with such difficulty to breathe, you need medical attention. Always look for something for your immune function also. Make sure that you have something that will boost your immune system, something like Flufend, Immunoguard, IM Defense, or even Ultra C1000 from Fineland at finelandvitamins.com. Number 4, the swelling of your legs, face, or eyelids. This is a very important symptom because the rapid swelling may indicate that there's fluid retention, yes, but there might be a heart condition or a kidney problem. In the legs, especially if it's just one leg, it could be deep vein thrombosis. Not a good condition. Needs to be taken care of as quickly as possible. It could cause your death. And the swelling of the face or throat might be even a serious allergic reaction. It could mean a kidney problem, chronic kidney disease, maybe even the swelling of your eyelids you haven't even recognized yet is not because you're tired, because the reality is that you might be having a kidney condition that needs to be treated. Number 5, fever that is lasting for more than 3 days. A fever is something actually pretty pretty good for the body. It's a signal that is indicating that your body is fighting an infection. But if it's lasting more than 72 hours, it may indicate that the body's not controlling it well, that it's actually losing control of the infection. After 72 hours, you're actually at a risk of sepsis. Maybe even this infection could be damaging other organs, like your kidneys if it's a urinary infection, or some other kind of infection that needs to be treated. And you can't treat it at home. It's not something that your immune system can take care of, because after 72 hours, you've actually not having any control of what's going on anymore. Go to the emergency room, visit a doctor, take some tests. It'll be easy to recognize where it comes from, but you need help to do so. Number 6, a severe or localized abdominal pain. Abdominal pain, stomach pain, is something very common. But if you're seeing it severe, localized, and it's really painful, this can become intense, sharp. Maybe it can be on your lower right side or even on the upper right side. Any of these two is a very serious condition. In some occasions, it could be appendicitis, maybe pancreatitis, gallstones, infections, or other intestinal problems. Any of these, and many of these actually, are very, very serious, especially appendicitis and pancreatitis. Also, gallstones can be a problem, but it all depends on where it's located, what is hurting, and what exactly needs to be done. The only way to do so is with lab tests, x-rays, medical help, emergency rooms, and doctors that know what they're doing. If you need something natural that can keep your abdominal health healthy and help you have a good immune function to make sure that you don't get sick at any point in your life, look for Cologon, Ulcerate, and GI Balance from Fineland at FinelandVitamins.com. Number 7, unexplained bleeding. Bleeding is always traumatic, right? No one wants to see themselves bleed, but if you're seeing that you're losing blood, right, without an obvious cause, down there, up here, maybe through urine, stool, vomit, frequent nosebleeds, it doesn't really matter. It's very important to have yourself checked. If you're seeing through feces, it could be a cancer. If you're seeing it through vomit, it could be an ulcer, maybe even tuberculosis if you're coughing some blood. It all depends on where it comes from, how it's being expelled. When you're seeing it, this all factors into, again, some medical help from someone that knows what they're doing. Number 8, unintentional weight loss. A lot of people want to lose weight. Yes, and it's maybe good to lose weight, but not when it's unintentional, right? When you're not doing a diet, when you're eating healthy at home, and you're seeing a noticeable weight loss that is not normal. This could be maybe an overactive thyroid, diabetes, a digestive disorder, chronic infection, or another maybe serious illness like cancer. It all depends, again, where it's coming from, the history you have with this weight loss that you can't explain. And again, you need medical help. Number 9, sudden changes in vision. These sudden changes in vision are common. Yes, they are, but they indicate something very important. Maybe high blood pressure, maybe low sugar levels in your body. Maybe you're having a hemorrhage, some type of bleeding on your brain, on your retina. Maybe even the eye pressure in your eye is changing. All these conditions are serious and they need to be taken care of. So, well, make sure that you fix the situation before something bad happens, like a stroke and even death, because the reality is sometimes we let these symptoms go and we don't know that what's really going on is our body's telling us that we need to fix it. Number 10, numbness and weakness in a certain part of your body. You see, when an arm, a leg, or one side of your face suddenly becomes weak, painful, numb, it could be a neurological development. And this is the exact situation where you have to do it quickly to get to the doctor. The time you take to go to the hospital, the more time you take to go to the hospital, the more time you take to get medical attention, the worse the situation gets, because it could be a stroke. It could be a situation where the faster you got to the hospital, the easier it was to get solved. So it's very, very important to take care of your health and make sure that any of the symptoms I mentioned in the video are actually something you take care of as fast as possible. Don't forget to give us a like button, don't forget to share, and I'll see you in the next video. Take care.